Sure thing. So I think Syed already gave a bit of an introduction. As he mentioned, I'm Jessica. I'm an acute oncology PA working for the past 10 years or so at UHN since graduating. And I work at the Princess Margaret Cancer Site, so mostly an outpatient setting, kind of managing oncological emergencies and doing some procedures, things of the like. And then I work as a clinical co-lead alongside Dr. Ryan Luther. So as I had mentioned, today's session is just to kind of give you, a brief overview about UHN, what we offer here, what our PAs are currently doing, and essentially some opportunities for jobs that are coming up in the near future. Ryan, if we could start the first slide.
Yeah.
Or maybe the second. Thank you. So I want to talk to you a little bit about just who we are. We keep saying UHN. It stands for the University Health Network. And the network is the healthcare and a medical research organization. We're located in the heart of downtown Toronto. And we're often viewed as a national, international source of research, education, patient care. When I think about the education that goes on, we often train students from across the globe. So they may come to UHN for specialty elective training or for fellowship programs. And it's considered the largest hospital network throughout Canada. We have, I believe, over 16,000 employees, and I think there are about 1,200 physicians currently employed at UHN. And when we speak of the network itself, it encompasses the Toronto General Hospital, Toronto Western Hospital, Princess Margaret Cancer Centre, Toronto Rehab Institute, and then we also joined with the Michener Institute. So now that is called the Michener Institute of Education at UHN. And I think, Ryan, we can go to the next slide. So I'd mentioned the hospitals. We are 4 hospitals, but essentially we're over 9 sites. So the Toronto Rehab Institute is actually 5 physical sites throughout Toronto. When we think about Toronto General, to give a bit of background, it's kind of a hospital known to be leading the way in cardiac care. We have a large organ transplant program. We treat a lot of complex medical patients. So their multi-organ transplant program, their cardiothoracic program, and medical education are really held in quite high regard. And when you think about Toronto Western Hospital, it's very well known for advances in neurology, neurosurgery. So it's seen as this world leader in neuroscience. It has a number of pioneering treatments when it comes to neuroscience. And though a lot of focus is often seen there, there are also great programs in musculoskeletal health, and they have a very large arthritis research program and a very bustling, very, very busy emerge department. So the emerge at Toronto Western actually sees around, I think, 60,000 or more patients annually. Looking at Toronto Rehab Institute, as I mentioned, there's about 5 physical sites, and it's more of a leader in physical and cognitive rehabilitation. So there's a number of very interesting programs at TRI. They focus on brain rehab and cardiac rehab, geriatric rehab, and there's various other programs where they kind of have these specific rehab focuses. So people come from all across Canada to see rehab at that site. And then Princess Margaret Cancer Centre, I mentioned that's where I've been working. It's the largest comprehensive cancer center in Canada. It has a cancer clinical research unit, which supports more of our clinical trials. We have another separate research institute, and that focuses more on things like genomics and biophysics, informatics. And then we also actually have a cancer campus, and it's basically a global source for cancer education. So there's courses that are offered to like current and future health professionals through the campus. I think we can go to the next slide. So I won't dabble too much into the research institutes, but essentially under UHN, there are 7 research institutes. They're all listed in the slide, and they are actually based at the various respective hospitals. Then we have 2 foundations. So Princess Margaret has a cancer foundation, and then there's a larger overarching UHN foundation. And essentially the foundations kind of help to donate and fund a lot of our programs. So, raises funds for research. You may know about things like the Ride to Conquer Cancer. It's raising funds for education and for enhancing patient care. Last year, I think Princess Margaret raised over 107 million, and they're usually raising about over 100 million annually. And then last on the slide, I just wanted to make note of the Michener Institute of Education, just because it's quite unique. It's the first integration of a healthcare organization and an educational institution, and it provides a number of opportunities for individuals to train in various healthcare professions. Next slide. Thank you. So again, a bit of background just in how we are governed and how we work. So concerning our affiliation, UHN is a TASN hospital network. And so when I say TASN, that stands for the Toronto Academic Health Science Network. So it's a network of various health organizations, and they kind of provide leading research, teaching, clinical care. When you're part of that network, you're linked usually to a university. So we are fully affiliated with the University of Toronto. And keeping that in mind in terms of our governance, if we have a voluntary board of trustees, but because we are affiliated with U of T, 2 of the members have to be appointed by U of T. Focusing a bit on kind of where does the funding come from for UHN. I know oftentimes, especially with new grad PAs, especially if maybe you're getting the physician assistant career start funding for that first year and kind of wondering, what will be next after that. A lot of our PAs will fulfill their first year contract, but we always do give the option to transition PAs into more permanent roles. We get primary funding for UHN through the Ministry of Health and Long-Term Care. And then there are a number of other funding streams. So there can be mixed funding from, I believe it's through patient services and some of our foundations that I mentioned before, like the Princess Margaret Foundation, the UHN Foundation. And then there's donations and there's grant funding that all help to support our network. Next slide. Looking at UHN, if you ever come to kind of work at the institution, you will see, slogans and signage and things around the hospital, really that point to the vision, purpose, and values of our hospital. It's kind of the backbone and DNA of UHN. So when you think about the vision, the overall vision is to create this healthier world. So you hear a lot of times things like patient-centered care. That is very much at the center of the care we aim to provide. And that vision kind of supports our overall purpose, which is to transform lives and communities by providing excellent healthcare, engaging in discovery through our research initiatives, and supporting teaching and essentially educating the next, batch of healthcare providers that are to come. And listed there, the third point is our values, and we try to focus on ensuring safety in the workplace, not just for patients, but also for staff. We want to ensure we're offering compassion with our care, and we want patients to experience equitable access to care. So we really focus on this teamwork, multidisciplinary approach to care, and we aim to work with integrity and often just, function as good stewards in the workplace. Next slide. Thanks, Ryan. So I wanted to focus a bit on, and this is, not all inclusive, but there are a number of benefits to working at UHN. I kind of focused on some of the key areas of interest that are often looked at when people are looking to new positions. For compensation, it is quite competitive, particularly highlighting PA compensation for full-time employees. We are amongst the top 85th percentile in terms of the market rate for our salary compensation. Additionally, as non-union employees, you do engage in an annual review process. And so on top of the mandatory expected annual increase, you are also entitled to what we call this additional merit bonus, and it's based on your annual evaluation review. And then there are things like we have standards for overtime premiums if you're working weekends, night shifts, on call. There's things like time and a half that you receive. Looking at our benefits package, we're very fortunate to have benefits on top of our salary. So you can get medical and dental coverage. I think that there used to be 5, maybe 6 plan options to choose from now at the time of hire for full-time non-union employees. And then you can also receive insurance coverage. So for shorter long-term disability, life insurance, travel insurance if you're going away, and accident insurance as well. And then you are entitled to paid vacation. It starts at 3 weeks in your first year, and then it increases over years of employment. And then there's things like adoption leave, maternal and paternal parental leave that are there, and we are part of the Hospital of Ontario pension plan. So there is pension plan salary to Hoop, like there's matching of your salary. In terms of well-being initiatives that we have on-site gyms, we have fitness classes, we have these massage days, and an RT might visit your clinic and offer on-site like chair massages, which is kind of neat. And then we have a family assistance program and mental health services, counseling that are available to employees as well. And in terms of development, especially, being a teaching hospital, there is a huge investment in individual development. There are leadership programs that are available that may be of interest later in your career. There are things like there's a 25% discount if you want to take additional education courses through the Michener Institute. And there are things that they offer as well. There's partial tuition assistance that you can apply for. So some of our, some more seasoned PAs are transitioning in their roles. They're thinking about things like management positions, teaching positions. Some have returned to school to, do a master's in education or an MBA. And there are funding supports that are available for that as well. Next slide. Thank you. And just a few additional perks. I thought one of the perks is, working at downtown core. That may not be a perk for everyone, but if it does appeal to you, it's a multi-ethnic population, there's great food, there's shows, there's events. If you're looking for something to do, there's always kind of something to do in the city. And then at UHN specifically, there's things like staff appreciation events. So usually we try to celebrate something on PA Day. There's a barbecue lunch every summer. During COVID, we received meal vouchers to get meals throughout the cafeterias at the hospital. And then we have a number of discount retailer services. I didn't list them all, but there's spa services, hotels that you get discounts if you're, visiting Niagara Falls or in the city. There's Good Life membership discounts, restaurants, various attractions. So every year when the CNE is on, there's discounted tickets to that as well. And then there's discounts to our gift shop, our pharmacy. There's this 50-50 lottery that you can opt to participate in. And I think tickets are something like $5 a month if you choose to participate. And then there's a huge lottery pick, and half the money goes to the person whose ticket is chosen, and the other half goes towards the UHN network. So it can be fairly sizable amounts of money that people win with that as well. So just extra side perks that we have. Next slide. So I wanted to discuss a bit about, what you're probably interested in more so with like what are PAs currently doing at UHN right now. So I mentioned before, I've been here for about 10 years, started in 2013. Prior to that, we had one PA that started about the end of 2012, and then 4 of us joined in 2013. So there was 5 in total for some time. Now we've reached to about 50, I think 51 now, because there was actually just an emerge hire today. So we're spread along various specialty areas. We are in the surgical services, general, thoracic, vascular, orthopedic, plastics, urology, ENT, gynecology, and then a number of medicine subspecialties. So general internal medicine, but then med-onc, cardiology, gastroenterology, endocrinology, transplant, and EDS, which stands for the Ehlers-Danlos Syndrome Clinic. And that's actually quite unique. It's the only clinic that's in Canada, and it's in conjunction at Toronto General and with the Hospital for Sick Children. So a number of people actually have to fly in and travel to be seen at that clinic. And we fortunately have a PA working in that area right now. And then radiation oncology, emergency medicine, and family medicine. In terms of kind of what PAs can do, it's a bit of a mixed bag. I think Ryan will touch on that a bit more in the second portion of the presentation when he's kind of giving you details on areas and different departments PAs are working. But you can be all outpatient, you can be inpatient, you can be a mix of both. You may function as a surgical assist in the OR, or you may, strictly see clinical trial patients. It's quite variable, and alongside your role, your schedule can be quite variable. So you may work a 9 to 5, 5 days a week. You may do 4 days of 10-hour shifts, or if you're surgical, you start at 6 a.m., but then you might end by 2 p.m. It really all depends on what's negotiated at the start of your contract, what really best fits for the needs of your division. And then there can be things like a mix of evenings, weekends, call shifts. So it's all quite variable and something that you can kind of, discuss ahead when you are negotiating your contracts. In terms of education development, that's also essentially kind of part of what we do. So it is a teaching hospital. There is an expectation that you're involved in things like rounds and, continued medical education. Fortunately, in many of the departments as well, we've kind of pushed that you also receive a certain level of coverage for this. So, if you need specialized skills training or conference education, there's often some level of funding or time off to help support that as well. Next slide. And then in terms of the overall, PA program development at UHN, as I mentioned, we've grown to be quite a big group. And so we've tried to put in some measures in place to really support this expanding PA role. So, there's myself and Ryan operating in this co-lead capacity, and we essentially serve as a liaison between the PAs at UHN and medical affairs. If there's questions, concerns, issues that may come up, we try to advocate on behalf of the PA group. We do try to make sure that everyone stays connected. You shouldn't feel isolated or alone or unsupported. If you're having challenges when you start work, there's often somebody who's already experienced something similar in the past. So we do have bi-monthly meetings, and we aim to share information, address any challenges, try to provide an opportunity to support one another, and hopefully develop some initiatives for overall program growth, because we do want to see an increase in the number of PAs throughout UHN, which is also kind of why we're having this job fair as well today. And then we are integrated with UHN medical education. So medical education department was focused more on medical students before. The PAs are integrated there as well. So we do get students from PA students from U of T, from McMaster, from external programs as well, maybe engaging in elective, and even a lot of the core rotations are done at UHN. And then we also support for first year PA students longitudinal placements as well. And then to help increase knowledge about PAs and let people know about why this might be an interesting program or career path for them, we do also try to support job shadowing opportunities. So for new grads or individuals in their fourth year of education, they may do 1 or 2 day job shadowing with the PA at UHN. So overall, that was just a bit of a brief overview of our institution. There's certainly more details that it didn't go into, but I hope it gives you a general idea of what we have to offer and kind of who we are, and just how PAs have been integrated at UHN. I'm going to pass this next session on to Ryan, and he's going to discuss some of the great areas our PAs are currently working in.
Great, thanks, Jess. So the first thing I think I'll say before I get into each of the divisions is the one thing I think is nice about UHN is we're one of the core teaching hospitals for the University of Toronto. And so I really feel that teaching and ongoing education is one of the core things that we do. And so especially for people who are maybe new to their careers and just coming out of their training, I think in many of the physicians and other practitioners here are used to very comfortable teaching people and helping to upskill people into a new career. And so, some of the divisions that hire PAs may be relatively specialized and focus on very niche areas like the Ehlers-Danlos Clinic, for example. But we're all very used to teaching, medical students, residents, nursing students, PA students, and likewise new PAs. And so we're committed to, ensuring that people are onboarded and are upskilled, and sort of a continuation from their formal training in school. So, and then even beyond that, we always want to ensure that people are growing in their careers, and that's sort of part of the continuing education that people have. And I think we do that well here in the sense that, you know, as I said, teaching is what we do every day, and career growth is important. So that's sort of one overarching thing. And I think now I'll go into some of the specific divisions and departments that work with PAs and what they specifically do. Some of these departments are hiring PAs and in the next year, and so this may be a particular relevance. So the first division I'll speak about is emergency medicine. And so we have two emerge departments at UHN, one at Toronto General, one at Toronto Western. As Jess alluded to, the one at the Western is particularly busy. The one at the General is as well, you know, seeing a mix of cases between patients from our community that live in the, you know, condo towers and neighborhoods around the two hospitals. But also, I think a very unique set of patients that drive to UHN because they're followed here for very specific problems. And so I do think it's a nice case mix of things between very complicated and specialized issues, and also just, you know, regular bread and butter things that come into any emerge anywhere in the country. There are currently 5 PAs that work in the emerge at UHN. There are 4 that are full-time and 1 that are 0.5 FTE. They basically work in very closely with the ED attending physicians, as well as with the nursing and allied health team. They interact with consultants through referring patients on for admission or for a second opinion from a consulting service. And they can basically see any patient who presents to the emergency department. And they will, you know, focus on areas with the highest volume or need in the given day. It's often in the ambulatory areas of the emerge, but they also work in the more acute areas of the emerge as well. And I think one of the unique things about the emerge is they get lots of procedural experience in terms of suturing, casting, reductions, INDs of various abscesses, et cetera. And then even some critical care procedures for patients who need to be resuscitated. They're involved in that as well. So it's a very high volume, high acuity area of the hospital, but also very exciting from that perspective. Some other benefits from working in emergency medicine. So they've really integrated their PAs in all aspects of the departmental operations. So they attend the emergency department rounds, business meetings, rapid improvement and QI initiatives, which is a big focus in the emerge, I find. They're involved in research as well as hiring of new physicians and recruitment events. And they also get yearly CME stipends, which you'll see is a common theme amongst, I would say, almost all of the divisions that we'll speak about today. So that's the emerge. Moving on to some surgical specialties. So orthopedics is one, and that's based out of Toronto Western Hospital. We don't have orthopedics at Toronto General. And so they've had a very long track record of working with PAs there. And the PAs there really work, again, closely with the physicians as well as with the allied health team, as well as with the residents and fellows in orthopedics at the Western. And they have a really full scope of practice, which involves working in the fracture clinic, doing consults, as well as working in other follow-up clinics and also in the operating room. And again, their PAs receive CME credits, ongoing professional development, and they really work quite independently within their division, as well as QI research opportunities. And I would say the PAs over there are quite happy with their job satisfaction, and the division head, in terms of the physician leads, are really value the work of the PAs in orthopedics and see them as integral and critical to the work that they do, particularly as we're coming out of the pandemic and they've had to ramp up some of their operating room time. The PAs have really allowed them to do some of that work, and so it's really seen as critical in orthopedics. In terms of oncology, so radiation oncology has 3 physician assistants. One is on parental leave, but they do have 3. And again, they work very closely with the staff physicians in rad-onc. It's primarily in the outpatient clinics where they'll see both new consults as well as follow-up patients. They work essentially traditional working hours of 9 to 5, and they see really any different type of patients with cancer in terms of site of cancer. So breast, GI, GU, neuro, and thoracics. Each PA has a dedicated workstation with a sort of 2 monitors, and they have storage space, which is a nice to have a place to kind of base yourself out of. And then they also provide travel support for CME events and other conferences, as many of the other divisions do as well. I would say one of the biggest divisions that hire PAs at UHN is medical oncology, hematology. So they have 14 PAs. I think that is the largest group at UHN, of which Jess is a member of that group. So they have 5 inpatient-based PAs and 9 that are outpatient-based. Again, they work directly with physicians as well as with the fellows and the residents. And then, one of the big things in medical oncology is lots of research. There's a lot of really exciting academic work coming out of Princess Margaret. And so there is opportunities for PAs to work directly in clinical research. There's a PA that worked at Toronto General who just recently moved over to work in clinical trials at Princess Margaret. So that was exciting for her. And so, it's lots of opportunities at Princess Margaret. Because there are so many PAs in medical oncology, they do have a supervisory committee that's chaired by a physician and a PA lead to kind of provide some more oversight and support for the PA group at Princess Margaret, in addition to the sort of UHN-wide support from that perspective. And they are provided with CME days and funding to support academic and educational endeavors, just like at the other divisions. Again, that's a common theme across, I would say, most of our divisions. In terms of what the 14 different PAs do, so it's a pretty wide spectrum of practice, and there are some areas you'll see circled in green where they are actively recruiting for new PAs. So they work within the blood disorders program, which can be both benign and malignant hematology. In terms of malignant stuff, so there's allo and allo bone marrow transplant service, as well as the leukemia service. And then in terms of solid tumor, they're recruiting for someone to work in lung cancer, as well as skin and melanoma. Again, I think there is a huge number of trainees and residents at Princess Margaret. And so I think, if it's maybe a bit, you don't have a lot of knowledge in oncology, I think there's room for you to be upskilled in those areas, to become hired and work in those areas and thrive. And because we're very used to educating people, it's one of the main things we do every day. In terms of the specific, so lots of from the waiting room, specific opportunities. So as I mentioned, the opportunity in allogeneic bone marrow transplant, that's a primarily inpatient opportunity to work with patients that are receiving cellular-based therapy to treat hematologic malignancies like leukemia. So they'd be doing mostly inpatient work, seeing the patients on the ward. And then there's a number of other inpatient opportunities on the leukemia service, which is one of the largest leukemia programs in North America, and a really comprehensive one in the GTA, where they treat patients with acute and chronic conditions, MDS and other myeloproliferative neoplasms. Again, these patients are quite complex and quite sick, and so there's lots of opportunity to see quite acutely ill patients, but also be supported by the physician and fellow group at Princess Margaret. In terms of outpatient opportunities, so there is an opportunity in thrombosis, and I can speak from personal experience working in that clinic. It's a very high volume clinic with a very focused area of expertise, dealing with primarily thromboses, which can be from cancer or other problems. And so they've got a really good streamlined care pathway in that clinic, if you want something that's very focused. Otherwise, there's opportunities in thoracic oncology, dealing with patients with lung cancer, which can include some relatively rare types of lung cancer, which is, if you're interested in those kinds of things, there's opportunities there. Or in the skin and immunotherapy program as well, which I would say the melanoma care is quite revolutionized in the last 10 years. And there's lots of patients can have actually quite good outcomes now. Lots of new therapies are available as well, so it's quite exciting to work in that area. And again, there's already a PA in that clinic, so there's opportunity to onboard with somebody who's been working there for some time. So bottom line, lots of opportunity in oncology if that's something that might interest you. One area of care which is new to PAs, which they're hoping to grow, is in nephrology. And nephrology is really is a patient population that involves a huge number of patients at UHN. They have over 3,000 patients, and really it's essentially 1 in 10 outpatients at UHN. And it's the kidney care at UHN has gotten relatively specialized, and so there are a lot of patients that can only receive care at UHN because of the specific problem that they have. And so, as I mentioned, it has gotten a bit specialized, and so there are lots of different clinics that offer renal care at UHN. And essentially, they're hiring really there's two opportunities to work both in the clinic, in the ambulatory clinics, and some of those clinics I mentioned, as well as in the hemodialysis units, where you'd be seeing patients who are at UHN receiving hemodialysis to round on them while they're receiving dialysis, deal with issues during dialysis and whatnot. I would say, nephrology in general can be a bit daunting. It's a bit of a specialized area of internal medicine, but our nephrologists here, again, they have a huge fellowship program, and they train huge numbers of residents every year, and are committed to upskilling any PA that would be hired to learn how to manage some of the kidney issues. And it really touches on all the different areas of internal medicine. And as I mentioned, they have a dedicated workstation, and they work directly with the staff physicians during typical working hours of 9 to 5. One very unique area of UHN, which is probably different than many of the other hospitals in Toronto, is that we have a very large transplant program. It's actually one of the largest transplant programs in North America, with a huge number of people working in it. There's 632 at the last count we received from the slides the other day, different members, and they really, do transplant care from all the way from pre-listing evaluation through to being listed for transplant, the actual transplant surgery itself, to the immediate post-transplant care, all the way through to taking care of patients, who are, 10 plus years post-transplant. And so there's really an opportunity for quite longitudinal care of these patients. And so it's quite comprehensive from that perspective. And there's a huge amount of support within the transplant program here at UHN. It is interesting in that, I would say many of the programs at UHN are relatively local or regional to just the GTA, but one thing about the transplant program is that we do support other provinces in providing lung transplant. For example, patients from Nova Scotia, New Brunswick, PEI come here for those for their care, or even further away from just the GTA itself. So it's a bit more of a national impact from that perspective. And there are lots of other partnerships with other agencies in Canada. As I mentioned, it's one of the largest transplant centers in North America. They often transplant, between 600 and 700 patients in a year, which is a huge volume. And so, because of that, it's a very exciting area to work. There's lots of support with a very large interprofessional team to support the clinicians, and they have, again, the support to train new PAs to work in those areas. It's a proven learning environment. They've been perfecting this for many years, and they're really a world leader in transplant care, which makes it very exciting. And really, you can specialize in one type of transplant or another, like heart transplant, lung transplant, kidney transplant, for example. They currently have 3 PAs in transplant that are 2 are full-time and 1 are part-time. So they do have experience in working with PAs in transplant. Back to surgery for a minute. And so the urology is another, in addition to orthopedics, division that has PAs. So there are currently 3 PAs that work in urology. They've been working with the urologists for 9 years. They work directly again with the staff physicians, residents, fellows, as well as students and nurses. They work under their own urology specific medical directives, as do many of the other PAs and other divisions. Just as an aside, there are medical directives that apply to all PAs within UHN, but some of the divisions, their PAs have gotten additional training or, work in more specific areas for which the divisions have created their own specific medical directives that may cover some more unique areas for that area of practice. So, for example, in urology, The PAs often work in cystoscopy clinic, as well as both at Toronto and Toronto Western, primarily in the ambulatory setting. And they actually be able to do procedures like cystoscopy, urodynamic studies, and managing stents, which is kind of a unique area of care specifically to the urology population. And they manage patients as well with cancer, as well as benign problems. So there's a bit of both there. They are supported to attend conferences, and they can attend one Canadian or North American conference per year, and their department covers the travel and accommodations for them. And then the last group I will talk about is one that's close to my heart, so general internal medicine. So here's a picture of we have 4 PAs in GIM, which I would say we're probably one of the newer group to hire PAs in the last couple of years. So Gabby, Evelyn, Raymond, and Ashley, and then this is one of our residents, former chief resident in the middle. I think they're actually all here, and so maybe I'll give them the floor for a second to just maybe speak about their experience working on GIM, and especially being relatively new to their careers, what it's like to come work at UHN. So I'll leave it to them to take it away.
There's 2 separate groups. Ashley is logged in separately, but the 3 of us are still here. My name is Raymond. I'm a graduate from the 2021 MAC PA class. Started at GIM straight out of school, was very green. Now just a paler green, just kind of working out of that. And then Ashley we graduated together, but she can speak to her story, and then I have my 2 other colleagues here as well.
Yeah. Hey guys, I'm Gabby. I'm one of the U of T grads. I graduated last fall and have been working here since like December, January of this year.
I'm Evelyn. I'm also a 2021 grad. I actually initially started at UHN in ENT, so on a surgical service. I then just transitioned to GIM earlier this year in January. So I do know UHN from like both perspectives as well. And yeah, our 4th colleague is Ashley there.
My name is Ashley. I started at the same time as Raymond. So speaking a little bit to working in GIM, as I said, Raymond and I were the first PAs in GIM. So we're kind of in a unique position that I think some of you may end up being in, being the first PAs in a certain specialty at UHN. So going into that, there was certainly some nerves, being a new PA, still trying to figure out like what your role is and working with your supervising physicians to determine what their expectations are and what kind of support you'll need. I'm sure Raymond can speak to this as well, but I think throughout all of it, we felt very well supported, and we felt like we were kind of making our PA role in GIM as a team, as opposed to being told, what were the expectations of us and what they wanted us to do. And it's something that is still evolving now that there are 2 more PAs added to the team. Even 2 years in for Raymond and I, we're still making changes to our role, modifying things. Everything is very, very fluid. And I found that the team has been really responsive to what our needs are as PAs, as we were new, as well as now less new, as Raymond said.
Jess and Ryan, are there like a set of questions or to go through, or should we just kind of like free form this? What's the format, I guess?
Free form is fine. Just talk about, what your experiences have been. Yeah, I would say.
Sure. I think Ashley summarized it very well. I guess to kind of paint a story, graduating and then kind of being in this limbo period of looking for jobs and everything. For me, the choice was always like very clear. I mean, I won't speak to specialties, but when it came down to it, I had one offer from UHN and GIM, and I had an outpatient family medicine job. And like I guess like the perks that come with working in a hospital are, especially one like UHN, you have the academic aspect. So I knew that there would be some degree of formal and informal teaching that would be implemented into my role. And then a very competitive like salary, benefits, vacation package as well, which I think Jess has kind of briefly touched upon as well. So I think the choice was always very simple. For people who are contemplating making the switch, if you're not like a fresh grad, I think you really have to seek out what you're looking for, and I guess it'll have to align with who's hiring. But my experience has been like, and not to be dramatic, but like exceptional. It's been very, very good in terms of like not only learning, but also finding a good spot here socially as well. There's a big group of PAs, and like just bumping into other PAs from different services. You know, there are many times where well, me, Ashley, and Evelyn are all from the same graduating class, and then 3 or 4 of our other classmates are also at UHN. So like from different services, and like bumping into them, taking care of the same patient is always a very nice surprise, as well as all the other PAs who work here as well. Lots of opportunities to continue learning as well. Like just recently, Ryan and Jessica have both been so receptive to us saying that, you know, we work in a service that does do procedures, but sometimes depending on the day, there might not be that many. They heard us when we said we're interested in doing more procedures, and found a workaround to get us more procedural hands-on skills. And I think just having that environment where we chat as a team, we find areas of growth that we'd like to pursue, and it happening is, I don't think, something that's unfortunately not always common to a PA position. Sometimes people get hired, they start, but then I feel like it can sometimes plateau. But I feel like my experience at UHN has been just kind of an upward trajectory. And I'll stop there.
Yeah, I agree. Like as a first year PA, there's been a lot of teaching opportunities, and Evelyn and I have also joined a lot of the resident opportunities here. Like in the morning, they have like morning rounds that we often go to, as well as like ultrasound rounds and things like that, which have been great. And working with Jess at the procedure clinic again has been really, really awesome. I think a tip for any new grads would be, when you're interviewing, also interview who you're getting interviewed by, to see if you'd enjoy working with those people, because ultimately I really clicked with the people I was getting interviewed by, and have had a great year so far, and really socially enjoy who I work with. And it's always a big laugh in the GIM offices, so that's been fun. So I think that makes a big like makes the job a lot easier on top of the medicine.
Yeah, there's always a dull roar in that corner of where you guys sit. It's great. It's great. I'm not complaining. It's great.
Yeah, I think just to add on to that, I mean, I think Raymond and Gabby both said a lot of things that I would have mentioned as well. But yeah, I think specialty aside, like UHN as a whole, I'd say like the big advantage is that, like, obviously I think you can tell too by the kind of like compensation packages, and again, like the support and everything. I think a big advantage of UHN is that they know, like, they value PAs, and that's very clear. I think that's running kind of trend and theme. Regardless, at least for me, like having undergone a surgical specialty as well, that hasn't changed for me at all. Like I think UHN as an establishment, that's always been a very clear message. Second to that, of course, like obviously because there's so many physician assistants here, even if you are the first one in the department, there's a lot of resources that you can draw from, just simply because there's so many members. So even though you might be like isolated in a certain department, I think that there's a lot of support that you can access as long as you know where to find it, and a lot of people to talk to and to support you. Like Jess for me was a huge support too when I was kind of doing directives in ENT, that kind of thing. I think and there's always like people that you can talk to that their position, it might be a bit more analogous to yours. So I think that even if you're worried about starting in a different department where there's no other PAs, I don't think that should be a deterrent at all. Especially at an establishment like UHN. Establishment, we're a hospital network. We're not a business. Yeah.
That's great. Any other comments, guys? That's good. Yeah. Thank you for coming, guys. I really appreciate that. It's nice to hear from you guys. So I think those were the slides that we had to present. I think, I guess now we open up to questions.
Yeah, so thank you, Ryan and Jessica, and of course our the other other individuals who presented, and of course the attendees. So if you have any questions to the participants, if you don't mind, maybe you can write them on the chat, and then we'll try and help answer those questions to the best as possible. And also there's a slide that you can see here for our the career site, where you can actually, I would recommend that you go onto that site and navigate through different positions so you can see. Of course, there are some physician assistants positions there as well. I did say earlier that I'm gonna put a link to a job posting. Actually, I just realized I need to do a minor tuning to that posting. So what I will be doing, once after this meeting, I will be emailing the recording. There's information sheet about benefits of working at UHN. There will be a job link, and it will also have of course, my email address as well. But I'm just going to write down my email address on the chat here. So if you have any questions that you don't maybe you want to ask right now, please feel free to email me, and I will do my best to answer your questions as soon as I'm able to. So I'm just putting my email address on the chat here, and I'm putting my name as well. This is Syed.
And there's a question too, what is the best place to look for UHN job postings for those working in other hospital systems?
Okay, what is the best place to look for UHN job postings for those who's working in other hospital systems? The best place would be to actually, our career site would be the best place. I would recommend to check it on frequent basis. We do promote our jobs on LinkedIn as well. I believe you can also create alerts like going through the LinkedIn, and of course through our career site as well. So that would be the best place where I would just check on frequent basis. Any other questions?
Or questions about the different opportunities or different positions and things people do?
Sorry, I cannot see that question for some reason. I'm sorry, Ryan, I'm not able to. There must be something happening. I'm not able to see that question.
Which question?
The one about the other. Is that the question you're referring to? What is the
Yeah,
best place to look for? Yeah.
Yeah, there's only the one question in the chat. That's
Okay. Okay.
we've
All
answered.
right.
Yeah.
Okay. Sorry.
In addition, if anybody has any questions that they want to reach out to us specifically, these are Jess's and my emails. If you have any specific questions about working at UHN, you can email either one of us. We're happy to answer any questions. And then are any of your EDs currently hiring? Jess, do you know if there's a current posting?
So there was the current hiring that just today got filled. There might be some future postings for the end of the year, early January. I was actually going to check in with the ED lead Sahand to see what that's looking like. But typically they have around 5 PAs running, but there might be some partial or part-time positions that are open. So I can check in with him and get back to the group if they're interested. And I see a question from Abhilash, if I'm saying that correctly, about looking to hiring only new grads. No, we're looking new grads, seasoned grads, if you're changing from one area to another. There's a number of different postings. So we do have a few career start postings, but there's also ones that are not based on the career start. Most of the DMOH ones are, I think half of them are not career start.
Any other questions from anybody? If there's no other questions, maybe we should wrap up here. Thanks everybody for attending and participating and for asking questions. And again, if you have any questions, reach out to us. We're always happy to help navigate some questions about where the opportunities are or whatnot. Hopefully you all consider UHN. We all love working here, and hopefully it's a good place to start your career. So yeah.
Okay,
And thank you, Gabby and Ashley and Raymond, everyone, for just kind of speaking as well.
Yeah.
Yeah, that really helped a lot. And Evelyn.
Yeah. Thanks, guys.
all right, thanks everyone. So we're right actually on the end time. So I'm going to stop recording now. And as I said, I will be emailing the recording, the benefits information, the job link. So please do look out for my email. Do check your spam folder as well, because sometimes your emails could end up in your spam folder. And if you have any questions, feel free to send me an email. I'm going to stop recording now, and thank you again and have a wonderful evening.
Thanks, everyone.
Thanks.